Welcome back, everyone. You are enjoying another episode of Fast Facts Pharmacology Edition, brought to you by a Tale 2 hygienist in partnership with Elevate Oral Care. And now, please welcome your host, Tom Viola.
Hi, I'm Tom Viola, a certified pharmacist, dental educator, and author. Stick with me, and I promise to make the next few minutes the best pharmacology learning experience you've ever had. Hi everybody, Tom Viola from Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. Well, this one's special because, again, it's brought to us by our friends at Elevate Oral Care, the makers of all-day dry mouth spray. And dry mouth is a topic you know I love to talk about. There are many faces of xerostomia. We believe that well over 700 non-prescription and prescription drugs thought to have xerostomic side effects. If you took those medications together or concomitantly, well, then you've got even more chance of getting xerostomia. But that's not the only story. The other part is what? Many systemic diseases can contribute to both the development of xerostomia and exacerbate its complications. So guess what? That means you're taking multiple medications for multiple diseases, all of which can occur concomitantly, and that's a great recipe for developing xerostomia. Okay, well, since we do know that xerostomia is a subjective sensation of dry mouth, it is often associated with salivary gland hypofunction. Okay, we know there's many causes, but we do know what? Whatever the cause, dry mouth sufferers are high-risk patients, and they need proper recommendations to help. Okay, so what can we do for them? Well, we do know prescription fluoride toothpaste is a great place to start, but it's not enough. These patients need something else, something to maintain the neutral pH around the clock, and at the same time starve the bad bacteria. Well, products like all-day dry mouth spray do exactly that. They're neutral pH, and they contain up to 44% xylitol, which is definitely going to make the lives of those little bacteria a lot more difficult. Now, we do know that normal pH is in somewhere between the 6.7 and 7.4 range. Well, if that's the case, if normal pH of saliva is within that range, then the saliva substitute should also be within that range. Well, a 2013 laboratory study of different popularly used common oral moisturizers showed that even after just 2 weeks, there was considerable loss of tooth structure in all of the sprays that were tested that had a pH of 6.3 or lower. Now, All Day, made by Elevate Oral Care, is manufactured to be specifically pH 7.0. Well, why do I care, Tom? I'm a dental professional. Why do I care about whether or not my patient has xerostomia? Well, is it xerostomia, as I said, a subjective sensation, or is it more salivary gland hypofunction, where fluids lost to things like evaporation, swallowing, even absorption through the oral mucosa? We do know this. There's up to a 50% reduction in salivary flow before some patients even notice they have xerostomia. So we really need to get to the cause of the xerostomia. Yes, it may be medications, it may be disease states, but whatever the cause, we need to make sure we get to that cause and rectify that and use products like all-day dry mouth spray to nullify the symptoms of xerostomia, that subjective sensation of dry mouth. Well, this has been Tom Viola from Pharmacology Declassified. We get another Fast Facts Pharmacology Edition. My friends, join me next time as we move on to other topics in the great world of pharmacology. Until then, be well. Oh, and one more thing. If you want to hear more from me, be sure to follow me on Instagram, Facebook, or visit my website at www.tomviola.com.
Thank you for listening to another episode of Fast Facts Pharmacology Edition, brought to you in part by Elevate Oral Care, creators of the innovative and proven prevention-focused oral care products from Advantage Arrest Silver Diamine Fluoride to Fluoramax Sodium Fluoride Varnish. Learn more by visiting www.elevateoralcare.com and schedule your free CE staff meeting today. We'll see you next time for another Fast Fact.